Hello everyone, Assalamu alaikum wa rahmatullah. Today, inshallah, we will discuss very important scenario from exam point of view, the scenario of pregnancy of unknown location. So in the exam or in the case that the notes of the case, you will find a patient, she presented to the early pregnancy assessment unit or she's in the emergency department. And she's here because she's pregnant and she has some discomfort like abdominal discomfort or pain. In this scenario, as you can see here, she's been waiting for 30 minutes and the clinic running late. The consultant is away for an emergency. So with your introduction and setting the agenda, apologize first about this late clinic. So just tell the patient that I'm so sorry that the clinic running late. I can see that you are or you have been waiting for 30 minutes. We will look into the matter to be sure that it will not happen to any patient again and to know why this happened today. One more thing that my consultant is away for an emergency, but I can continue the consultation on the consultant's behalf if you agree for that. So is it okay? So ask the patient for the permission to continue on the consultant's behalf and apologize about late clinic. It's a very important point of communication. And take care in the exam, you will find one or two cases with late clinic. So it's very important. Then in the case notes, you will find her report. You will see the name, the age, and NHS number. And then you will find that the beta HCG is on the higher side. So this patient is pregnant. However, the ultrasound showing no intrauterine pregnancy sac, the adnexia are free. So how to go through this station? It's a very easy station, but it's very important to know how to tackle this station and how to go through the possibilities. Then here you have 10 minutes and you will be assessed on all the domains like information gathering, communication with the patient, patient safety, applied clinical knowledge, and communication with the colleagues. So as we mentioned, introduction and agenda, introduce yourself, ensure the patient name, take care that ensuring the patient name, it's part of the safety now to be sure that this patient, the patient, you have her notes. So just introduce yourself first and then confirm the name, ask the patient, how would you like me to call you? And then tell her that you have gone through her notes and you understand that she's here today because of this problem. So just say, I've gone through your notes and I understand that you are here today because you want to know the results of your blood test and the scan done for you. Is that correct? Yes, doctor. So do you have any other concerns or expectations from this consultation today? And then ask her the permission, like to ask her some few questions to know more about her. For the information gathering, follows the template of the early pregnancy. Start with open question. Would you please tell me more about your problem? And then if this patient has discomfort or pain, ask or analyze the pain. Where is the site, the exact site? What about the type, severity, since when? Referred or not? What increase, what decrease? If it's controlled with any painkiller or medication. Then go through the other points. Is there any bleeding? Our patient, she has no bleeding, but if yes, so what about the amount? Any blood clots, any lump, any pain, any shoulder tip pain, very important question, any dizziness or feeling unwell, any nausea and vomiting, and to ask about nausea and vomiting in layman language, like feeling sick, being sick. So this is in layman language. Do you experience or did you experience any loss of consciousness? And don't forget to ask about folic acid. Here, one of the possibilities is a normal pregnancy. So we need just to double check that this patient started her folic acid. Then the personal questions, as usual. As you can see, we are following the template of the early pregnancy. Here, the questions will be the same in the upcoming 2 slides, like to check the personal history, asking about smoking, alcohol, recreational drugs. What about the BMI of this patient or her weight? If this patient has any drug allergy, what about her blood group and any reservation for blood transfusion? Safety points, very important. For the drug allergy, it's the safety point of all modules. Don't ignore to ask this question in any patient. But for the blood group, it's important if the patient is pregnant. And for the blood transfusion, again, during the pregnancy, and any patient will go for a surgery or any patient with a bleeding. So we need to double check if this patient can accept the blood and the blood products or not. Then menstrual, just double check what about the last menstrual period and the regularity before this pregnancy, any contraception used before the pregnancy, what about her obstetric history. Gynecological history here not important, so we can remove this question or just omit this question. Ask the patient, do you have any medical problem of concern? Do you have any surgeries done in your tummy or down below before? Do you have any family history of concern, especially for the blood clot or the clot formation in leg or lung? This sexual history you can ask here because one of the possibilities will be the ectopic pregnancy. So give one signpost like, I'd like to ask you some intrusive question. I'm sorry, it's personal questions, but it's very important in our management. Shall I proceed? Yes, doctor. So ask the patient in the past or now, did you experience any form of sexually shared infections? No, doctor. So here you have to give one signpost before the sexual history because it's intrusive questions, and ask the patient immediately after that. Mental, in the last 4 weeks, did you feel depressed, low, or loss of interest? Like you are not interested to do your usual activities. It's very important, the usual activities. And what about support at home? And then just say, thank you for sharing this information with me. Usually my advice, don't ignore this line. It's for two reasons. Number one, to appreciate that the patient, she was sharing or she's sharing this information, which is confidential and personal. Number two, it's like a pause, like to take a deep breath, and now we will move to the next step. Like I'm done with the information gathering, I will move to the next step. Next step will be examination, and here the examination, my advice, it's up to you. Justify. If you want to examine, why do you want to examine? So this is the last word from the RCOG. If you want to examine any patient, please justify why do you want to examine the patient. Okay, so I'd like to examine you, or I'd like to offer you examination in presence of chaperone after your admission. Is it okay? Okay, doctor. So what you want to do, I want to measure the blood pressure, the pulse, I want to check your tummy, I want to assess you from down below to check if we have any obvious lesion or any bleeding. So if you want to examine, please justify why do you want to examine. Now coming to the report. I will go back to the report to tell you how you will tell the patient the results, okay? And then we will come here to the explanation again. So moving backwards, sorry, here. All right. So now, Elizabeth, I have your report with me. After confirmation of your name, age, and NHS number, take care, guys, patient safety to confirm the name on the top of the report. This blood test is showing what about the level of your blood or the strength of your blood, and it's normal. It's okay. We don't have any problem here. The pregnancy hormone level in your blood, it's higher than normal. It means that you are pregnant. However, the scan showing that your womb is empty and there is no pregnancy inside. We don't have any lesions. We don't have any problem. The egg baskets or the ovaries are okay. So I can tell you that you have a condition named pregnancy of unknown location. Have you heard about that before? No, doctor. Here, is it a breaking bad news or not? If you want to do, it's not bad news because still we don't diagnose ectopic or anything. But if you want to do breaking bad news, make it mild with one signpost and keep it like a concerning news. It's not bad news yet. So it's just concerning news that we cannot locate the pregnancy. So the pregnancy of unknown location. Ask the patient, have you heard about that before? So usually the patient gonna say no. So we do have three possibilities for that. It might be too early to visualize the pregnancy, and this pregnancy is normal pregnancy inside your womb. Usually we may face some difficulties to see the pregnancy before the 6 weeks, and we need to follow up this like with a pregnancy hormone level and then a scan. Am I clear so far? Yes, doctor. The second possibility will be the miscarriage, meaning that you have miscarriage and you will lose this pregnancy. and the pregnancy hormone level will keep positive or will stay positive up to 3 weeks. And again, we need to follow up that. Do you have any questions, or are you still following me? Yes, doctor. The third possibility, to have the pregnancy outside the womb, which we named medically ectopic pregnancy. We do have many different locations for that. It can be in the tubes or on the egg baskets or in your lower tummy, and very rarely to be in your tummy. And again, we do have many like blood tests and scans to be offered at that time. Am I clear so far? Yes, doctor. So shall I move forward in your management? Yes. So your management will be with a group of expert team, including my consultant, specialized nurse, sleeping doctor, if needed. So take care, sleeping doctor will be only if we will diagnose ectopic and we need to go for a surgical management. But just keep the patient aware that we may need a sleeping doctor. So what we need to do now, we need to repeat the pregnancy hormone level in the blood, and it has to be done. And we will come to this, another safety and tricky point in this scenario, to be repeated in 48 hours. So what about the mistake done by many candidates? To tell the patient, please come after 48 hours. But if you will go back to the scenario, you will find that these blood tests and the scan done for the patient yesterday, if it's not written there, how to manage. So tell the patient that you will come after 48 hours from this test done. So when did you have this blood test and scan? So the patient gonna say, yeah, oh, it was yesterday, doctor. Okay, so I will book you tomorrow for another blood test. Take care, safety point, tricky point in the exam. If you will bring her in after 48 hours, so now it's a big mistake because it's 72 hours after the first blood test. When we repeat the pregnancy hormone level, we have three possibilities. We might find significant increase. So if it's increased more than 63%, in the exam, don't tell the patient more than 63, it's for your knowledge. Here we will name this significant increase. So it means it's a healthy pregnancy inside your womb, and we need to follow up you with a scan after 2 or within 2 to 3 weeks. Am I clear so far? Yes, doctor. If we have significant decrease more than 50%, it means that it's a miscarriage, and we need to follow up you with a urine pregnancy test after 3 weeks. If we have increase, but it's not significant increase, just 50 to 63%, but you will not tell the patient the number, as I told you. So just say it's increase, but not significant. It's not a significant increase. So we will suspect at the time ectopic pregnancy. And to diagnose ectopic pregnancy, we have to offer you more blood tests and serial scans to diagnose or to locate the pregnancy. Am I clear so far? Yes. Another mistake here, guys, and usually it's done by the candidates, that you will stop here. Like if it's significant increase, healthy pregnancy. If it's significant decrease, miscarriage. And you will not tell the patient about the ultrasound here, the urine pregnancy test here, the serial scans and a blood test here. So please, this is a frequent mistake. We will not stop here. The patient has to know what about the next step after that. Okay, so as I told you, if it's early pregnancy and it's normal, further scan within 2 to 3 weeks. If it's a miscarriage, urine pregnancy test after 3 weeks. Is it necessary to offer this patient with a miscarriage ultrasound? No, it's not a routine. However, we may need to offer her a scan to be sure about the lining of the womb. If this patient still with bleeding or any concerning symptom, at that time we may need to offer ultrasound. But what about the routine? The routine urine pregnancy test only after 3 weeks. Ectopic pregnancy, additional blood tests and scans will be needed and stop. Don't explain here. Some of the candidates also, I'm telling you the frequent mistakes so you can avoid while you are doing the station. So some of the candidates will start to explain more about the management of ectopic. No, because the management ectopic is like a very big topic, and it's a case or a scenario in the exam. So here just touch the point of additional blood tests and scans will be needed. So please don't ignore this slide. We need, what about the further step or further management in this patient? Now we will send this patient home. She will come tomorrow. Please, any patient with bleeding, pain, and she's pregnant, you are suspecting ectopic, don't forget to give the red flag signs. Any patient, for example, with threatened miscarriage even, don't send her home without red flag signs. So now I will send you home, or you will be back to your home, Elizabeth, and you will come tomorrow. I will, however, if you have any of these symptoms, please come immediately to the emergency department or contact our unit. I will provide you with a contact number. It's 24/7 contact number. So what about this red flag sign, guys? Any bleeding heavier than the period, any pain, severe sharp pain in the tummy or lower tummy, sharp pain to the right or left side, feeling dizzy, feeling faint, pain in your shoulders, diarrhea or loose stool, but take care, diarrhea has to be with another symptom, like with any of the above, any symptom from the red flag signs with diarrhea. So consider this like one of the red flag signs. Don't forget to give her a contact number 24/7 to be available, or to come immediately to the emergency department. By the end, don't forget to give her some leaflets regarding the pregnancy of unknown location. Set another appointment after 24 hours. Book her for this blood test to repeat the pregnancy hormone. Okay, I wish this is clear, guys. I wish it's easy now. It's very easy station, but it's tricky in many points, as I told you during the station. So you have to be sure that you covered all of these points, and you will master this station in the exam, inshallah. Thank you so much, and have a good day.